this and then share my screen. All right, so everyone, welcome. I know this is a really big topic that everybody um, always asks about this, and so we wanted to do a long presentation about this. And so we're gonna go, and as we go, please type your questions in the Q&A, and we'll answer all of them. And I know some of my other colleagues are going to come in a bit, so we're going to have a few more people joining in and doing a little talk. And so a couple of disclaimers that I want to make is that this is basically, I'm not receiving any funding or sponsorship from any programs that I'm mentioning or anything. Some of these are my opinion, but also my experience and knowledge of working in healthcare for 10 years. Experience running programs, interactions with academic medical centers and admission people, so some of the work that we've done through here. And everybody can see the presentation, right? Yes, cool. And this is just like any information you receive in life, don't accept it as face value, but research it. We're going to make this PowerPoint presentation available. We'll post it on the website where you registered, but also the video will be posted as well. And so again, check for it. I put a lot of links on them, and so you could double check them as well. I referenced the California mostly for a couple of reasons. First, California tends to be stricter than most other states and more regulatory, maybe except New York and Illinois. It's just not better, but it's just California has a lot of regulations. And the other part of it too, I've worked in California the longest. And so those are the reasons why there's some of the reference. Not that it's better, I'm pretty sure a lot of these things can be universal as well. And like I said, I'll do my best to answer questions, and please type them in the Q&A and I'll go through them and answer them live. So this is a couple of big things you have to understand. There is healthcare experience, and which is basically that you're in a healthcare setting as a volunteer or observer. You're not touching the patient, and I'll a little bit go over that, or providing care. So you're not doing any of those things. Patient care experience and direct care experience is when you're providing direct care to a patient. Means that you are putting on, you're taking blood pressure, you're putting on Band-Aids, you're doing EKGs, you're doing things, and you're manipulating them in a sense where you may have to move them, and you have to be certified and licensed to a standard of care. And again, this is because of a responsibility and legal liability. You don't want your loved one to go to the hospital and some pre-med student who's never been there to take your, grandma and put her on another bed or anything like that. And so these are really important things. And that's why healthcare is a very, challenging place to go in. A word on shadowing is not patient care experience, it's passing experience. Basically, it's passive experience. And so you're just basically there to watch somebody else does. It's a good starting point. But anything more than 75 to 100 hours, it would be like, okay, what have you done? And the other part of it too, like that's a significant amount of time not doing much. And so I'm one of those people that likes to get involved. And so basically I would say, and people always say, well, how many hours should I do? Should I do 100? Should I do 1,000? And basically for medical school, you should do enough hours to know that this is what you want to do with the rest of your life, that you want to commit to this lifestyle for the next 50 years of your life, or yeah, 50 years, actually 40 years. And you want to be useful for, investment in the knowledge, so that if the medical school accepts you, they're like, okay, this person has done their due diligence. If anybody asks you to pay them for clinical experience or shadowing or anything like that, I would run away. And I'll share a little bit more about that. But basically, you shouldn't be paying anyone for anything I know that some of the places will make you charge you $5 for like an ID card. Those things are fine, but anything more than, if you come in and do 20 hours, you have to pay $500 or whatever. So, patient care in California and the United States, understand that healthcare is the most regulated entity in the US. Um, and so it's regulated more than anything. It's also a large part of our economy. It's about a third of our economy. Facilities, hospital clinics, doctor offices, they're licensed by state, county, and federal. And and so and federal. And so that's kind of one of those things that you just have to be um, it's just very regulated. Litigation from errors, but also has a strong enforcement mechanism. And so if somebody gets hurt or harmed or anything else, then you know, then it's there's a lot of issues. People's lives are in your hands, and so you want like I said, do you want somebody else who doesn't know what they're doing treating your grandma or any of your loved ones? And you have to be certified and licensed to do patient care. And that's like one of those big things you have to understand is that there is a whole um, part of it that you have to be able to, and you say, well, I'm working somewhere and they're letting me do stuff, and that's great. But first, that place is liable for letting you do anything that you're not certified. If something goes wrong and you're taken to court and they'll ask you, hey, Joe Blow, are you certified to do this thing? Well, no, they told me to do it. It's like, well, they may tell you to jump off a bridge. Does that mean you do that? And so understand that, whatever you do, that you're certified and licensed to do it. Understanding the scope of practice and not crossing it, it's actually a felony in jail. So you see these movies that EMTs are putting in trachs and stuff like that. That's all not real. Like any of that stuff, you're putting yourself in legal danger, but also it could really hurt someone. And so, and I'm not really going to go over more of the stuff. If you take any kind of certification, they'll go over that. And then basically staying in your lane. So if you're a EMT, a CNA, stay within that scope and don't decide to crack someone's chest open and operate it. And so, and there's also legal issues in healthcare. And so that's why you can't just like walk in anywhere. It's because patients have privacy rights. You can't let anyone in a hospital or healthcare setting without clearance. You first have to do background check to make sure that they're not um, that you're not some sort of deviant or things like that. And you got to be cleared for health clearance, and that means that making sure you don't have TB, you're not going to expose anyone to it, but also if you get sick somewhere, and I'll go a little bit more about that as well. HIPAA is basically a House Information Privacy Protection Act, and when you get to see, you could take a quiz on what HIPAA is. And it's a pretty severe thing that if you violate that, and I'm really not going to go more into it, but you could go check out this blog and see what happens. Patient safety is people who touch patients are trained and qualified, meaning that you take a course and you pass it and you're tested and you're qualified and you're also recognized by an entity. And then also basically says that you are certified to be safe for whatever your scope of practice is, patient thought. Volunteering is safe. If you volunteer any place, they take that, assume that responsibility if you're hurt. So that's why a lot of places don't want volunteers, because if you walk in and something falls on your head, who's liable for it? And so, and then also they want to make sure you're safe, and certainly with COVID and a host of other things, it is it is a big issue, and are they going to be safe? So this is paid versus unpaid for medical school, and I know physician assistants have a whole different thing, and I could talk about that as well. Um, and so paid is that basically you're responsible and liable for your actions. You are accountable to someone above you. That means you have a boss or supervisor. You are certified or licensed. You are a professional, and people depend on you, and you can be fired. So the difference of it. Unpaid is you have flexibility, and the place has to kind of adhere to what your schedule is. You have the freedom to take time off. Like nobody's going to say no, you can't take. Usually, some places, if you're even a volunteer, they want you to have a commitment, and so it is low stress, low responsibility, and you can be choosy. And so, um, and that's one of those other aspects of it. Now, there's pros and cons of being paid and unpaid. Pros is that you're making money, and now you can make really good money doing that. And so, everybody has to put a roof over their head and food in their stomach and bills to pay, and so it's a good way to make good money while you have to work and pay for your things. But you have to also show, you also shown responsibility that this entity institution can trust on you. You have gone through a selection process, means that you've applied, you've interviewed, you've gone through an orientation process, you passed a 3 month period what is it called? Where basically first 3 months they could fire you for anything. I forgot what it's that called. I'll probably remember it. And then you're taking care, of your, applications and money and everything else that you have to pay for. The cons of it is you have to be certified, so you have to spend some time being trained, taking a test. You have to go through some training and orientation. You have a boss to answer you. That means that your boss expects you to show up on time, be present. Your boss doesn't care that you have an OChem exam. They have patients and other things to take care of. You have to deal with rules and policies, means you can't do whatever you want. You sometimes you're forced to do mandatory work, and that's in healthcare setting that happens quite a lot. And part of the job is that you're dealing with contagious patients and you're dealing with combative patients. And so again, that's all the things of it. Some other pros and cons is um, it can be flexible to your job. You don't have, unpaid, you have no pressure or responsibility. If it's unpaid, you have no pressure. You can't get fired. Nobody can fire someone from that they're not paying. They could just ask you not to come, but that's not being fired. You don't have to do anything that you're not comfortable with or you don't want to do. So if you're volunteering somewhere, somebody says, "Hey, I need you to, I don't know, take this and think of anything," you can say, "No, I don't feel comfortable doing it." You can take time off for your OChem exam. You can basically say, "Hey, I'm not going to come tomorrow. I have some X." And then, and then, and you can be, but part of the other ones, you can be around doctors and patients, and you get to interact with them without a responsibility. If you're having a job and you want to go see a certain procedure and those types of things, you have to do your job. So again, the cons of being unpaid is that no one is going to give you full patient care responsibility. And again, we talked about that. And they don't count and depend on you, which is kind of a thing. I mean, we have volunteers that I see at my work, and I think there's some of the really awesome people. But again, I take that responsibility and not them. And so you can't really count on them. Some of them may not show up. The other part of it is that you're not part of the tribe. So it's kind of the click thing is if you're working somewhere, you become part of a tribe. And so this is a myth that we've heard over and over again every week. And so I just want you guys to, we've asked every dean of admission that comes that, um, they only want you to have volunteer experience. And that's not true. Unless you're from a wealthy family, you have to pay for housing, bill, food, school, transportation. And so that's not true. You cannot get patient care experience without being licensed and being accountable for. If you're getting paid means that an institution has put faith in you to provide direct patient care. Again, this is all the stuff on your application. You have a boss or an institution that you're accountable to. You went through a selection process and you were the best candidate to be hired. You have gone through orientation to learn about rules and regulations of that institution. You're dependable, show up on time, can follow rules, regulation, work in a team atmosphere, and in order to keep your job. Since a lot of people need to work to survive, you're killing two birds with one stone, meaning that you're getting your experience and you're getting your paycheck to pay for things. Things you should know about healthcare, with COVID-19, there's overburden and, and now COVID is slowly, going down, and we're seeing a lot more volunteers and other things coming in. And so this is more of like, because of COVID, there was a lot of uncertainty that we couldn't let volunteers inside hospitals and care facilities. Um, this is, this is what you should put in your mind, either you're in any kind of setting, shadowing, anything. It is not about you. You are not the center of attention. Patient care, their families, business, and people's jobs take a priority to that. Um, this is a really big pet peeve, and I've seen a lot of volunteers do this, and I've sent them home personally when I've worked with them. Leave your cell phone in your car. Um, we don't know what you're doing, and I know, like, I personally take a lot of notes on my phone. And you see people at work doing it, but you don't understand when it's the right time to take your phone out. And if you don't have that discipline, leave it in your car or leave it at home. And this is a really big pet peeve that is in a lot of healthcare settings. So just letting you know that. Also, bring a pen and paper pad. I have a paper pad that I always carry with me, even at work. Um, it's these little things that, I put in the back of my pocket and I have it with me, and I just take notes. And then you cannot take any recordings or pictures. And I know that it's really cool. You put on your scrub and you want to take a picture to put it on your Instagram, and you want your friends and family and everything. Do it, but go do it in the bathroom or do it somewhere private. Don't do it out in front of patients or anything like that. Because I can tell you this, I've seen nurses and medical staff lose their jobs because of posting pictures. And I guess do not take, any of that stuff on there. You could look at this nurse fired for Instagram posts, and you could find hundreds of them. There was actually a couple of days ago at Emory Hospital that a couple of nurses put a TikTok, and all of them lost their job. So be really careful. Things you should know about healthcare setting. If you're volunteering, you're a guest, and that means that, you know, treat treat them with respect. But if you're getting paid, you're part of the tribe. In healthcare team, everyone's really important, and everyone plays an important role. And if you're shadowing or if you're volunteering somewhere, put this in the back of your mind. Respect others. That means from the head of the department to the nursing staff, to the ancillary staff, even to the um, um, EVS people, environmental services. Everyone is important and plays a role. I could not do my job in the ER if the EVS staff, are not doing their job. And so there's a healthcare team and there's a hierarchy. And basically, nurses, techs, patient care technicians, all of them are gatekeepers to doctors. And so if you're really nice to the staff, you will get a lot of good access. I could tell you from my experience, if I see a volunteer that is professional, shows up on time, is not rude, is always available, willing to help. If there's a good case going in the OR, I'll walk them up there myself and let them watch a case. Or if there's a cool procedure going on, I will let them in so they could watch and observe. But if you're flaky, rude, we're just not gonna, we're not gonna care. And that's a human behavior that everybody does that. Um, People will always test you as well. And that's basically, I call this the blanket warmer test. I always tell volunteers, hey, I have one job for you to do the next 4 hours that you're here. There's a blanket warmer. If it's empty, just put new blankets in there so it's warm and toasty for the patient. And if I go in there and grab one, if the thing's empty, they're like, okay, this person really didn't get the instruction. But if it's always full, it's like, okay, you know what, Johnny has done a good job, and I could trust them with something else. And it's not about you, even though you're there to learn and experience. You're not the center of the universe, and stopping somebody during a code, asking them what's going on, not appropriate. That's why you have a paper pad and note. And at the end of it, you could always ask, hey, what did you guys do to this patient, or what was this happening? And people will be more than happy to explain to you, but not in the middle of what's happening. And And so things that you should get, if you want to work in the hospital, if you want to volunteer, if you want to shadow, get comfortable shoes. And basically, comfortable shoes mean get shoes that have closed toed. They're darker color, not like the green, you know, um, basketball, tennis shoes. Make sure it's black. White, you can get white, but white gets dirty really fast unless you like cleaning your shoes. Get black shoes. Um, Comfortable. I mean, comfortable means that you've wore them around the house and around other places. And then also paper and pad. And like I said, have that with you and show up on time. Either it's for your job, for your clinical shadowing, volunteer, anything else. That is like the worst thing people do. And showing up on time doesn't mean that if you need to be there at 7 o'clock at night, you show up that means you show up 15 minutes early. There's the saying that if you show up on time, you're late. If you show up early, you're there. And if you're late, you're gone. And so this is one of the big things. And so, um, that means that you have to make sure and anticipate traffic and everything else that could happen in front of you to get there. And so, one of the other things that you could do on both online but also personally is get your CPR card and first aid. It's a really important thing to get if you want to be in any facility. Some volunteers just that's like the bare minimum for anything. And so if you do that and you like it, you could even become an instructor and get paid teaching it. And this is really important. Get your American Heart Association BLS for healthcare provider. This is kind of like the entry point for any kind of healthcare certification that I'm going to go over below. And so, yeah, so this is like really important. Basically, if you want to find out how to get that, just Google AHA CPR certification and your city or zip code and Google, and you'll get this. And so I put San Francisco, this is what came up. And so, and then make sure your vaccines are up to date for COVID and everything else. And I'll let you pull this up is for healthcare worker recommendation. So you could get those at your doctor. Also, all your student health centers will have these vaccines as well. Taking a personal inventory. Hey, Giselle, sorry. How are you doing on time?
I'm good. I just kind of got to go back in around like 7:40, the absolute latest. So it's up to you.
Okay. I'm going to actually stop and let Giselle talk about scribing because she's actually at work. You can turn on your camera. She's actually at work. And so why don't you do your medical scribing so she could go back to work. And so you could go ahead and share it.
Okay. Sorry. I didn't mean to interrupt.
No. I just want to make sure that you're at work and you have to go to work. So I'll let you take over.
All right. Are you able to see the screen?
Yep.
All right, cool. So hi everyone. My name is Giselle. Like Jubin said, I am a medical scribe. Currently with the RWJBH group here in Jersey. I graduated Seton Hall with my Catholic Studies and Biology degree in May of 2022. So basically, I just want to talk about what an emergency medical scribe is and what we do, how you can get involved and everything. Sorry, I am wearing a mask. Like Jubin said, I am at work, so I have to wear a mask. So basically, an ED scribe, most people would simply describe it as a assistant to the emergency physician, physician assistant, or nurse practitioner, because here, at least here in Jersey in the emergency room, all of those three providers have access to patient care, and then we'll be giving you notes to document, and you're going to be working one-on-one with them. You're also helping the physician or the physician assistant and NP deliver the best and most efficient patient care. One of the other big things that we are held responsible for is ensuring that the proper billing requirements are met for both an emergency room in the fast track area pediatrics, as well as RDU, which is their rapid diagnostic observation unit. And I will talk more about that later. So with medical scribing now, after post-COVID, there are 3 different positions, I guess. One would be in person, which is what I do. Telemedicine, where you're like on a screen with the doctors, the patients, and you take notes like that, as well as virtual, where sometimes providers will voice memo you notes, and you're working from home basically, and you're not in the ED, you're not actually with a patient at all. You're listening, simply listening to notes and writing those down. So with that responsibility comes pros and cons. Um, there are a lot more pros that I would discuss. Um, the biggest one is mainly the one-on-one collaboration with physicians, physician assistants, and nurse practitioners, simply because those are the people you're going to be working most closely with. You are working with nurses and techs, and everyone involved in the ED patient care, but specifically it's those providers who you're writing the notes for, who you're making sure you document everything. So it's really good at building those relationships with them, especially if you're looking at getting recommendations or just learning more about emergency medicine in general, or any healthcare position. You're also learning about the MDM, which is your medical decision making for certain diseases and complaints. I've been here for about 5 months now, and I can say I've honestly learned so much at how, like someone comes in with abdominal pain, you're gonna be like, okay, cool. So doctor's gonna be looking for Murphy's signs, probably order an ultrasound or a CT of the abdomen. They'll get, if they're vomiting or anything like that, they'll get Zofran, or you start like getting familiar with certain medications, certain diagnostics, and you start building your own little outline in your head of how the providers are thinking, of what they're looking for, of what signs or what diagnosis they're trying to cross off to get to that specific diagnosis that they will be giving the patient, as well as where the disposition of the patient will end up. Another pro is you become very familiar with the medical terminology and diagnostics, like I said. You will learn, I'm not saying you're going to learn everything. It does take time, and you're obviously going to study it all eventually, but it is a good way to start to recognize certain terms, to start learning the medical term versus the layman's term of certain things. You know, a lot of the doctors will talk to you in everyday wording, and it's your job to transcribe that into medical official documentation and wording and everything like that. So it's a really good way at getting to know both sides of the conversation. Another thing that I find is really nice about being a scribe is that you can be anywhere. You can be in the main emergency room. You can be in the rapid diagnostics unit, which is basically an adult observation where we keep patients that came in, let's say for abdominal pain and vomiting, but they haven't completely resolved. So we'll put them in observation, watch them overnight, wait for scans to come back, and then if they're going to have consults in the morning, we'll put them there so you can scribe there as well. In fast track, which is where we keep our not as severe or life-threatening patients that come in. In the hospital where I'm at, we have a lot of patients who are minorities and don't have primary care providers. So sometimes they'll come in for a prescription refill, or we have a big population of homeless people. So when they come in, you know, we'll give them treatments or anything if needed, but we'll usually put them in fast track just because it's not a life-threatening situation where they need to be in the main emergency room. We also have a pediatrics emergency room where peds go, but you can also be a scribe as an outpatient, so in a clinic. You can also be an inpatient. Once patients get admitted, you can scribe for providers in those areas and different specialties as well. It all kind of depends on what hospital you go to, what company you decide to sign on with, and obviously the state that you're in. I know that here in Jersey, one of our biggest companies is RWJ, which is the one I'm at, and they only do emergency medical scribes, but also there's Scribe America, which is a good way to get hired, and they're across the country. They have positions in inpatient, outpatient, and emergency rooms. However, there are downsides to this. One of the cons, I guess, to being a medical scribe is the amount of patients the EDCs is the amount of notes you're going to get. And so with that, I mean, with notes, it's basically the physician's chart, and it outlines in detail what the patient came in for, what they're feeling, their review of systems, the physical exams, any diagnostics, labs, who the doctor spoke to, what the doctor found. So basically everything that encompasses their emergency room visit is what you're documenting. And so if there are 50 patients actively in the waiting room, I have 50 active charts. And it's not until those patients get discharged that I close off the chart. I put in their discharge times, their diagnosis, and I'm done with that. So as you're waiting for certain scans to come back, for the disposition to be decided, you're also watching and waiting for those scans to come back, for the labs to come back. So essentially your job is to monitor everything so that when the providers finally get the chance to come back, and you can be like, oh, by the way, Jane's potassium was high, or the CT results showed hematoma, or the CTs were normal, or ultrasound was done, so you're helping keep everything moving. So you are in charge of watching and monitoring a lot of things for several different patients. So multitasking is one of the key skills that scribes should have. So if you're not very good at that, then it can be kind of difficult. Another con would be is that the requirements for documentation is changing. And that's both statewide and with providers. So in general, basically, you go through your training, and in your training, you're taught of certain billing codes and requirements that need to be met in order for your chart to be billed correctly. And so as billing is changing, obviously your charts need to change as well. But that also applies to provider specific. There are certain providers that like certain wordings in their charts. Certain providers that don't do a full, in detail neuro exam. There are some who do everything. For example, here in the ED, we have one provider who, let's say you're coming in with abdominal pain, they'll focus specifically on your abdomen, rather than, do a full neuro where they're checking your gait, they're checking your pupils and everything like that. I mean, they'll do a general, but then you have another provider who is going to go in detail through every single system in the body, and they want that in their charts. Certain providers want word for word of what they said. Other ones kind of want you to make it more formal. Some providers will talk to you, like I said, in layman's terms and common terms, and it's your job to put that into medical terms and make it sound formal and professional. Another con is the day versus night scribes. I mean, obviously, if you're working night shifts, everything's gonna be different compared to the days. However, I am a night scribe, so I work night shifts. And with that, it just means overnight, not everything's going to be open. So our scans, our MRIs, our CTs, our ultrasounds, majority of them stop getting done around 11 p.m. So it's my job to make sure those scans are sent to an outside facility to have their radiologist read it and send them back to us. So I'm constantly in contact with radiologists outside of my hospital. And usually at nights, it's only me. in certain parts of the ED. So like for tonight, I'm in the observation unit. So it's only me there with the 2 other providers. There's one in the main ED, and they're going to be there.
Provider means doctors, right?
What happened?
Providers mean doctors, right? I don't think most of them.
No, yes. By providers, I mean like the doctors or the physician assistants or the nurse practitioners. So yeah, but then in the day, you usually have 3 or 4 scribes with you so that each scribe gets assigned one provider. So like there'll be a 7 a.m. scribe with a 7 a.m. doctor, a 9 a.m. scribe with a 9 a.m. doctor, an 11 and 12. While at night at 7 p.m., it's just me and let's say a doctor and a physician assistant. So you kind of have to handle a little more because you're keeping track of both the doctor and the physician assistants patients as well. The other thing about being a medical scribe is that these hours don't count as direct patient care hours. So I know Jubin was talking about, as a tech, you're able to work with the patients and do things with patients. As a medical scribe, you are not allowed. At least in New Jersey and New York and Pennsylvania that I'm aware of, medical scribes have no authority to touch patients. So let's say, unfortunately, someone goes into cardiac arrest and they need CPR. Even though I am CPR certified and I am an EMT outside of this hospital, because here I'm only a medical scribe, I am not allowed to touch the patient. I can ask for help and I can get the nurse, the doctor, the physician assistant, or anyone who is authorized to touch the patient, but I physically cannot actually touch the patient. That's also for your protection, the hospital's protection, and the patient's, because if anything does go wrong, you don't want it to come back to you. And with that also comes translating. A lot of our patients here are Spanish speaking, and as much as I would like to go and help and translate because I am fluent in Spanish, I can't do that simply because if the patient doesn't fully understand what has happened or they misinterpret something I said, it can fall back on me. And God forbid, and something happens, they go to court and they'll be like, okay, so why did you translate? Why did you do this? Why did you do that? You can't defend yourself just saying the doctor asked me to or the PA asked me to. So as a scribe, your hours are more so shadowing hours in a sense, where you're seen, not heard, and your main interactions are with the doctors, the PAs, the NPs. You're also working with the nurses and the techs to ensure patients are getting the medications they need. They're going to the scans or going to the rooms they need to be going to, and making sure you keep the flow of the ED going. So basically, that's kind of what a medical scribe does. So now to become a medical scribe, these are just a quick little 3 bullet points I found on Google just by looking it up. But I'll talk more into the actual process of becoming a scribe. So one of the main requirements here is to be at least 18 years old, simply because you are working with patients and you need to complete certain trainings that require you to be 18 years or older. Many facilities will require you to have some basic familiarity with medical terminology. This doesn't mean you need to know everything, and it doesn't mean you need to have heard everything. There are definitely words and abbreviations and terms that I was not familiar with before I started this job, but it is helpful to know, what you do an EKG for, an abdomen, or the different quadrants of the abdomen, that kind of thing. You need to have passed a background check and medical clearance. So you need to be physically fit in a sense to be a scribe, at least in Jersey, and obviously proficient in English. At least here with Robert Wood, majority of the providers' primary language is English, and your documentation will be in English. So you need to be able to read, write, and speak in English. And then the preferred requirements, which majority of hospitals or facilities would like to see on your resume and would also be helpful to you as a scribe, would be having an experience in direct patient care. So this could be either volunteering at a hospital or being an EMT or anything like that, just so that you're somewhat aware of the chaos that could occur in the ED, being very attentive to the detail, being able to multitask and work under pressure. These are very big characteristics that you should be able to have as a scribe, just because you are making sure all the small little details of like their physical exam findings, the diagnostics, the labs and everything, you're making sure everything is correct and that it reflects as to what the doctor was thinking or what led the doctor to diagnose the patient with whatever diagnosis they do. Able to multitask. Like I said before, you're going to have like 30 or more patient active charts open, each with their own scans, with their own labs, that you have to keep track of and make sure that when they come back, you inform the provider and you're documenting all that as well. A typing test. So you should be able to type fast. Majority of the facilities here require a 50 word per minute basically result. And I will provide a link for a typing test later on. But basically, doctors are dictating notes to you, meaning they're speaking to you. And majority of the doctors will not speak slowly. You're in an ED, everything's very fast paced. So they're going to be talking to you, and it's your job to make sure you write everything down. You type it all out. And so you want to make sure you're fast. One of the good things to have is a passion for patient care and medicine. Like Jubin had mentioned before, it's not about you, it's about the patient. So even though you're not directly touching the patient, you are involved in patient care in the sense that what you write is what they will be getting billed for. And so if you write something that's not true, or you say, their labs were normal, but they really weren't, and then they end up getting a medication, they're going to be billed for the medication, but they won't know why. And your report won't be reflective of that as well. Another preferred would be college level science courses, simply because you get more exposure to the science world and medical terminology. These are just some quick little abbreviations and terms that I found on Google. You simply could look them up and study off of those like that. Like I was saying, majority of the doctors won't talk to you in medical terms. They're very comfortable with talking to you in slang. So for example, we get a lot of overdoses here. If a doctor will be like, a crackhead, you can't put that into the records. You have to put it in the medical terminology and say, either a cocaine addict or a TCH abuse or ETOH abuse. So that kind of thing. So basically, very simply put, for Robert Wood, which is a company I'm at, we're specifically in Jersey. However, Scribe America is all over the country. You would apply for the position, and while you're waiting back to hear from them or waiting for an interview, it's good to begin reviewing and learning your basic terminology, practice your typing speed and your accuracy, and making sure everything's good there. Many of your training is about 4 weeks. So the first 2 weeks, you're usually virtual or in a classroom setting where you're learning the medical terminology, the most basic and most common. You're developing your shorthand dictionary, which is basically your abbreviations for everything. You're taking typing quizzes, enhancing that typing, making sure your speed is increasing. While week
And you're getting
2,
paid, right?
yes, you get paid for your training. Yeah, I should have mentioned that before. For the 4 weeks of training, you are getting paid. They used to call it a classroom salary, but I was getting paid the same amount I'm getting paid now. So it's nice. In week 2, you learn about the components of the physician's notes. So you learn in detail of the different sections of a physician's notes, the reason why they came in, the components of the review of systems, of the physical exam, of the diagnostics. You're also starting to learn the tracking shell. So what we call a tracking shell is basically the big screen where you see all of your patients, the doctors, the nurse, the tech, the scribe that's assigned to that patient, as well as what labs were pending, what scans are pending, what are done, they're vital. So that's basically where everything's being kept track. And so you're constantly monitoring that, making sure, okay, the CT is being read. I'll come back in 5 minutes. The labs are being processed. Or, okay, the ultrasound results are back. You copy and paste those into the results. Tell the provider, by the way, so-and-so's ultrasound came back. And you start practicing the real-time dictations. So this is when the trainer will start giving you dictations or notes. And at first they'll start off slow so that you get familiar with having someone give you a whole ED visit, and then slowly but surely they'll start increasing their speed so that it becomes a faster dictation. And you're using the shorthand dictionary you developed to apply that to here. Majority of the times, a physician will take no longer than, I want to say 5 minutes to give you a note. And 5 minutes is a lot for a physician to give you a note. Most of my providers within 3 minutes have given me the reason the patient came in, their primary doctor, the review of systems, physical exam findings, what diagnostics they're doing, what medications were given, and more so of an idea of what they plan on doing with the patient. So it's very fast paced. And then week 4 and 5, you're on site. So you're actually in the ED and you're practicing with the patient, with another trained scribe, and you're with the providers. So the first time you're on site, you're starting to get familiar with the program. You're creating macros, which is basically shortcuts to certain findings. So for example, in our charts, we have to put in any prior records. So that'll be done with a macro. So basically, you'll put like 2 periods and put in prior, and then it'll automatically populate any prior records that the patient has in that ED. So you're starting to do that to make your work go by faster. And you take dictations with whoever's training you. If you feel comfortable enough to write the notes, they will let you. If not, it's just starting to get familiar and used to how the doctor speaks, the speed at which they speak. Some doctors have accents, some don't. Some mumble, some don't. So you kind of have to get used to that, and that's what that 4th week of training, 3rd week of training is. And then the 4th week, you're basically on your own. And this is where you put everything you've used to train to use. You're taking notes on your own. You're taking dictations on your own. You're tracking everything. You're doing start to finish on notes. And you're still with a trainer, but this trainer is more so in the background. They're reviewing the notes and making sure you get everything. But basically, this is where you're on your own and you're kind of doing your own thing. So like I said, the physician note has different components into 4 categories. It has the subjective component, which is the patient's feeling, why the patient came in here, what their symptoms are. The review of systems, which is basically like a quick little physical as to why they're here, what came in, what hurts, what doesn't hurt. Then you have the objective, which is actual factual information that the provider states. So this would be the physical exam findings, the vitals, labs and diagnostics, the results. So it's actual facts as to what is wrong with the patient. Then you have your assessment, which is your differential diagnosis. So this basically is more so the provider deciding what is wrong with this patient. Why does their stomach hurt? Why does their head hurt? Why are they feeling dizzy? That's where this comes in. And then lastly, you have your plan. So a patient can either be discharged home, they can be admitted to the hospital, or they can be put in observation just because they don't necessarily meet admission criteria, but where the providers are not sure enough to have the patient be discharged home. So quickly, some tips for scribes or becoming a scribe. Practice your typing speed. Typingtest.com is a great website that I use, and a lot of the scribes here use as well, just to get familiar with typing really fast. Like I said, majority of people want 50 words per minute or more. When I was hired, our minimum was 70 words per minute. So it helps. They also have a medical typing test. So they'll give you medical prompts so you get familiar with actually typing medical terminology. Practice your dictations and shorthands. You can honestly just go to Google and type in dictations for medical scribes, and they'll, press play and open up a Word document and start typing like that. Once you are a scribe, I suggest taking shorthand notes separately, and not actually in the official physician note, just because while they're talking, you're not going to put in abbreviations in the formal document. Be very specific as to what happened with the patient, what they're doing, what they're looking for. Create macros and templates. Like I said, it's very easy to get through a note once you have set statements or auto-populated results into it, just because your notes will go by so much faster. Don't be afraid to ask providers as to why they're getting certain scans done, why they're looking for their potassium levels or anything like that, or what they think it is. Providers will be very happy to answer questions and help you learn, because the more you know, the easier their job gets, because you're able to start templating their notes and start realizing, okay, so I know they came in with abdominal pain. Okay, so they'll either order an ultrasound or a CT. So you can put that into the chart without having the provider necessarily tell you, I'm going to do this because of this, this, and this, And lastly, like I had mentioned before, stay within your scope of practice. You don't want to do anything outside of being a scribe. Like I said, as a scribe, you're not allowed to do actual physical patient care. So make sure you remember that and keep that in mind. And like I said, HIPAA, if you do decide to be virtual when doctors voice memo you notes, it's understood that those notes are completely confidential, and once you're done with the note, you delete it, because God forbid you lose your phone or someone gets into your phone. You don't want that kind of information being spread out and then coming back to you. And one of the biggest things you learn as a scribe is that if it's not documented, it was not done. So like I said, if I put in my chart the labs were normal, and then the patient turns out had high potassium levels in their blood, my chart doesn't say that. So if the doctor gives a patient certain medications and I said everything was fine, it's gonna be like, so why did they get these medications? Everything was fine. So you want to make sure you document everything, what the doctor did, who the doctor talked to, what consults were made, what consults were ordered, and everything like that. So that's basically it from me. I'm gonna stop.
There's one question, two questions. One is how much is the pay, starting pay?
So it all varies as to where you go. I am currently being paid 19 an hour, but that's also because I'm nights. Days get paid differently. So it all depends on whether you're working day, nights, and what company or what facility you go to.
Yeah, it ranges between 14 to 25 nationwide. So it depends. If you're in Kansas, it's probably a little bit lower. New Jersey and New York and California a little bit higher. And then the other thing is, and scribing is not just in the hospital, right? It's everywhere.
Mhm, mhm.
Yeah, there's scribes in ophthalmologist office, orthopedic surgeon. There's a whole wide variety of medical scribes. So, but all right, well, I appreciate your time, and I know you have to get back to work, so we'll continue. Thank you again. If you have any questions, just put them in there, and yeah, so we will continue on with the rest of the presentation. Thank you.
All right. Thank you. Have a good night, everyone.
All right, so going back, taking personal inventory. Something happened. Okay, sorry. Taking personal inventory, asking how you can be beneficial. Again, these are things that, skills that you have, computer skills. Some of you are better at computer skills at 18, 19, 20 than a 58-year-old. Some of you know how to do web design, coding, social media. And I'll go um, a little bit further into some of the other things that we're going to do that. And so there's the community college dilemma, that there's no student-run clinics. That's true. There's not a lot of pre-med opportunities. That's true. You could throw your hands up and say, oh, well, and there's not a lot of pre-med insights or programs. And so, and some of you are going to say, I'm going to wait until I transfer. And I would say that's kind of wrong because there's a lot of competition when you transfer. At UC Davis, I think there's 5,000 pre-meds and 12,000 at UCLA. And so there's a lot of things you could do where you are in your own community. Um, and so again, getting in student-run clinics is a very challenging. Plus, you're going to get there where there's already juniors that have spent 2 years there. And so, and once you transfer, you're required to when you transfer, you're required to finish on average of 16 units. And so, and you have to do research, bench research and taking the MCAT and keeping your grade. So I would say don't wait until you transfer. The JC student, community college students, you're in your own community, you know the ins and outs. Average student is at a community college for 3 years. But the other thing is community colleges have EMT programs. They train the most nurses anywhere. They have EMT, respiratory therapy. So they have a lot of these community health worker, which is another big one now because of the pandemic. They found that is a really big area that needs to be done. And so, I mean, I would look at it as a strength. You have priority registration. A lot of these training classes are short 3-unit classes. Most of them are on weekends. You know where it is. You're already going to school there. And so look at some of these trainings that I'm going to go over. This is something that I'm going to be really upfront with you. There is a lot of these training programs. They are not all created equal. Do your research. Look at the state and national entities, for example, for EMT. You could find out you know, who's training you and what's their pass rate. Some of them have like 40% in the pass rate. And so I wouldn't look at any of these private training centers that don't have high yield. You are paying for the speed. There are some EMT programs that could be done in 2.5 weeks. And if you're taking OChem, bio, and a lot of these harder classes, EMT class is pretty easy. Some of them just cost way too much money, and so $3,000 is a lot. And you're just gonna have to figure out if you're paying $3,000, how many hours do you need to work to pay it off? And I would say, and some of you could hustle. I know there was a group of students that wanted to get this EMT training at, I think it was Berkeley, and they basically volunteered to work in their front office. They got a group discount, and then they did a bunch of stuff which lowered their cost. This is COVID. I mean, COVID is a challenge, but again, right now, COVID is starting to, you're getting more volunteers, more work, and everything else. And so, but COVID has upended healthcare. There's a lot of uncertainty at the beginning. There's a lot of liability issues. There's a lot of stress on healthcare workers. So if you're volunteering, shadowing, make sure that there's a huge shortage, and medicals get that. But I think moving forward, I think if you're going to start applying from next year, a lot of people are going to have clinical experience and exposure because they found a way to do it. And so that's not something to do that. And so this is a volunteer in the ER. Is you basically go to the office, you sign up, and you get assigned. It's a good stepping stone. I would say start looking at smaller local community hospitals. Most of you guys are big, go to the big university hospital, like for example in LA, go to UCLA, and it's a great, but then you're dealing with a lot of the other pre-med students from UCLA and these big universities. Um, the smaller local community hospitals, you're going to get a way better return because there's less students in there. The big academic health centers also have medical students, residents, fellows, and so there's a lot of steps of learning, and you kind of become the last person on the totem pole, on the pole. And so, and then just again, be respectful and listen to students, being perfect at the small things in order to be great at the big things, and then, like I said, the blanket test I told you about, the other glove box test is what I done is I tell the volunteers, okay, like you're here for the next 4 hours. All the glove box that you see here, if any of them are empty, refill them. And then I come back and check. And if they're all refilled, it's like, great, this person is dependable. I could count on him. I'm going to give him another task, or if there's a cool procedure happening, I'm going to put him in there and they could go watch, or because we know what cool stuff are happening that you would be interested in. So again, overcoming, um, challenges. You can't volunteer. I mean, we're seeing a lot of volunteers coming in. So, and so, so there's other things you could do. You could get these short certifications that get paid. There's a lot of opportunities. There's a lot of, shortages. There's a lot of people that are burned out, and there's a huge need. And again, taking care of your personal inventory, so if have certain skills that a place could do it, then take advantage of it. And most of the training now is from home. I mean, I was talking to somebody we just hired, and I was orienting them, and the entire orientation was done, like hospital orientation was done virtually. So I was like, that's pretty cool. And I know there's some of these classes that are being done virtually as well. Contact Tracer, this is a free thing. You could get a certificate on Coursera. I know that there used to be a lot of contact tracers, but it's diminished quite a bit. And so I'm not exactly sure if there's a lot of contact tracing, but if you want to, again, look for contact tracing jobs, you could use this Google, get the certificate. It's absolutely free on Johns Hopkins University. And there's millions of people that have done this. And so there's also an advanced course that's free. COVID vaccine and testing. This is actually was a significant thing that a lot of people did. They're not happening anymore. They're mostly done at clinics, and so should probably take that out. Translator. I know that the unfortunate thing is there's no national translation standard, but each place has their own requirement, and so some people take volunteers, some people will pay. So in being fluent in the foreign language, meaning that not just taking Spanish 1 in high school, but understanding and knowing um, the procedure. And in California, it's very expensive, and so if you have that skill, some hospitals will certify you. FHU clinics have to have them legally, and so you could always look for translating jobs if you're competent in the language. You could volunteer. Most of them are paid, and there's also courses that you could take at some community colleges that you could get certification for it. But unfortunately, it's not like CNA or EMT or any of those big national. Giselle just talked about medical scribing. I would say it's fun. I think they're underpaid. There's these things you could look at. Medical Scribe Institute. Somebody messaged me in there that says that there's place. I think it's like $2,000. I would not pay for any kind of training unless it's a place that you work at. Um, because they like to do it a certain way and there's no like national standard for it. Scribe America is probably the biggest one, but they're not everywhere. So Google Medical Scribe, the city or the county that you're in, you get a good result on it. Patient transport, orderly, lift team, patient escort. These are some of the titles you will find at hospitals. They are one of the coolest jobs I think you could have. I think because you get a little tracker and basically they call you to move patients. It's a great job to get your foot in a hospital. Matter of fact, one of our previous ER techs that we hired was a patient transporter. Patients in the hospital need to move around from the ER to the CAT scan to the CAT scan to the ICU, from the floors to so you'd be surprised how many patients move in a hospital. And so only thing you need is a CPR, a BLS, healthcare provider license. It's really easy. I think you get it for $40 now. And the other cool part of it is you get around the entire hospital, so you'll meet all the other departments and all the other cool things. And basically, if you're not moving patients, you're not doing much else. So, but you could get pretty busy. You kind of need to be in good shape. I think some of them say you need to be able to lift at least 50 pounds. You stand on your feet for a long time. They do have a lot of part-time positions as well. And so if you're looking for these jobs, Google patient transport city. You may get van transport, but van transport's a little bit different. Lift team or patient escort. And so these are the big three words that you look at, or you could go to your local hospital website and then check it out. EMTs, this is kind of what I am. It's a great stepping stone. You learn a lot of skills and you become very good at taking patient history. You identify emergency signs and symptoms. It's taught at almost every community college in California and in most of the country. You need to have a BLS provider license and you need to have an emergency response course. I would say if you take an OChem bio, then the classes are pretty easy. The challenge is people that are really book smart, they're not really good at hand and action and dexterity. And so that's a little bit challenging, but there's nothing that you cannot overcome. A lot of med schools are now actually requiring the summer you start your medical school, you become an EMT, and they put you out in the community on ambulances with paramedics and other people. And so a lot of med schools are doing it. The reason I know this, I have a friend who went to Hofstra, and that's what they did. You need to have 168-hour total, which includes 24 hours on an ambulance and 12 hours in the ER. Then you pass the test, and then you get licensed by the state and county. You have to pass a background test, and your driver's license needs to be clean. So if you've got too many, if you've been drifting or anything like that, if you have a record, it would be challenging. There are levels for EMT. There's the basic level, there is the AMT or advanced. It's just an extra course, and paramedic is an 8 months full course, and you need to be an EMT for at least a year. If you're a pre-med student, EMT paramedic is just a very long course. It's actually a full-time 8 months plus your clinical. It comes out to about a year, and so and it's just a little bit too long. If you're not at a community college, there's, like I said, I don't get paid for any of these. UCLA has one, which I think they do a really great job, and Project Heartbeat. But again, there's a lot of other ones out there. I would check the state certification and their pass rate because not all programs, um, you know, created the same. I would also say if you want to get a job, um, ambulances, it's basically in every ambulance, that's what EMTs are designed for. Um, I would say go work in an ambulance that doesn't do a lot of 911 calls. And the reason why I say this is yes, 911 calls, which is lights and sirens, paramedic, everybody, you go into a gunshot wound, car accident. The problem is that as an EMT, you're again the low man on the totem pole, and you get to drive. So you're not doing any patient care stuff. Usually there's a paramedic, firefighter, and if it's a one paramedic, one EMT, you're driving the whole time. So, and the reason why the paramedic could bill more. So that's another. So there's a lot of I would say probably 70% of ambulances do inter-facility transfer, which is taking patients from hospital to care facilities to people that are a little bit older and they fall to have contracts with them. And so that's probably the best way that you could learn your skills. And it's one of the best places that you could do this is interfacility transfer. There's also a critical care transport where it's one EMT and a nurse, or EMT and a paramedic. And so, and that usually requires you to have some sort of EMT experience. And that's a really cool thing because you're dealing with a lot of sick patients, you get babies, you get really cool stuff. And so, event medicine, you get to go to concerts, sports game, large events. Casinos have a lot of EMTs. Movie sets, if you're like in LA or any place that has they hire a lot of EMTs, and there's a lot of event medicine companies. And emergency departments, they do hire EMTs, but you need to have at least 1 year experience on an ambulance, have a phlebotomy license, and be an EKG 12 lead technician. And so that takes a little bit long time, and it's a process, but some people do it. There's other opportunities. EMTs, Rock Med, which is a and dear near organization in my heart. Um, you basically, the minimum is you need to be a BLS provider, and you could go work at Rock Med. It's mostly in Northern California. So, so yeah, and then you get a lot of MDs and PAs. Since nobody's paid, it's all volunteer. You get to interact with doctors and nurses and PAs, and it's a great learning environment. They do a lot of like teaching modules and stuff. And then COVID-19 vaccine and testing, which that used to be a lot of EMTs, not as much anymore. And then CrowdRx is an event medicine company that they've done a lot of COVID-19 clinics, but they do a lot of concerts across the country. They're actually owned by AMR. And so check those out. Patient care technicians, there's a variation of EMT, CNAs, phlebotomy, medical terminology, and there's not a national certification for it. And that job is available at a lot of hospital, and and so they're trying to figure out how to circumvent. So there's a lot of jobs out there as well. And again, Google patient care technician and your city or state. Um, Phlebotomy is another really great or training to have. Some community college just teach this. There's this company called Phlebotomy Training Specialist that they're nationwide. They do it. It's a little expensive. I think it's like $2,000-$3,000, but it's a 40-hour training in the classroom and 40-hour lab. This is in California. Um, Other states have a lower standard, so I think like Nevada is like 60 hours. Oregon, I think, is 70 hours, and so you just have to figure out where your state stands and where but this is California. It's a great place to start. I know like a friend of mine who does this. He basically sets up his own schedule, and insurance companies for life insurance and health insurance basically pay you $100 to $150. You schedule, you go to people's homes, or they come to you, or you mostly go to their homes or place of work, anywhere they want you to. You can't do it at a Starbucks because that's like a big no-no. But and you get like 100 to 150 bucks a person. So it's a great, way to pay off your. It's a great job for gap year. And if some clinical research projects require you to draw blood, and so it may give you the advantage of, um, um, you know, so it's a great part of it. And somebody asked a question. I just saw um, somebody message me, and we will get to all the Q&A questions, and so if you basically, this is for all specialties, phlebotomy, well, EMT is a little different, but phlebotomy, one state is not the same as the other. So if you get in California, you have to look at what Massachusetts requirements are, and I don't know what those are. And so you could always find out. And every state has a website that you can take a look at and find out. So I don't know, um, to be honest with you, what are the standards. But I know that as an EMT, you get the national test, and then you go to each state and show your thing. They may have some requirements. Phlebotomy is the same thing. You take a national test, which is through the NMHA, and then you go to that state, and then you have to put in the hours and all the other stuff, and then you go there. And so these are the stuff that I put on there. You can take a look at it and look at the detailed information. Um, um, CNA, which is another great thing that you could do in California, it's about 150 hours to get it. And um, it's the highest requirement California does. Some other states are like 110 hours. You need to be at least 16 and you pass the state exam. And each state has its own nuances. And so hospice care, elder care, hospitals, private homes, home health, memory care, and you're basically providing basic care, bathing, and CNAs are awesome. They do really excellent work, and they're hugely needed. I know a friend of mine who went through 2 years of um, college, and she was a CNA, and she was basically got to live rent free at somebody's home and take care of this woman. And she was, she basically just had to make sure she took her medication and helped her with taking baths. But she was able to rent live free in Berkeley, and also got I think a few, $300 a week. I think like $400 or $500 a week. And so it can be a great thing if you could find it. Um, again, CNA with the pros are, you can have flexible hours, great experience, and you provide an excellent need. For me, it's a little bit slower paced, taking care of patients that are, either terminal or in bad state. And then you do, lifting and turning, so you have to be physically be able to provide that. There are programs out there. Again, look at the state agency that you're out, and figure out which one's the best. Some of them charge a lot of money. I know a lot of community colleges have CNAs and CNA training programs, and so look into those. And then outside of California, I know the Red Cross does all of it, a lot of the training. This is another registered behavioral technician, and this is basically an online training that you take for $99, and um, and then you take this exam at this website, and then free programs. There's Autism Partnership Foundation, where they have free programs that you could take through them. And registered behavioral technicians, you basically work with children and folks that have autism, ADHD, and other areas that they do that. And it's a great role and a great job, and it pays pretty well. Home health aide, again, it falls under CNA. There's other states that have home health aides, and I don't know much about it, but I know that if you Google it within your state, you could figure out what the requirements are. Life child specialist, you actually need to have a BS, and so I wouldn't really do it. Anybody that's interested in women's health, OBGYN, become a doula. You could get the certificate for 60 hours. Basically, you're a trained professional. You're not delivering the patient, but I mean, you're not delivering the baby, but you're providing emotional information support for the mother, before and after during childbirth. And California, they use a lot of doulas, and some of them you could actually make, $1,000 for pregnancy for patients. And again, you're not delivering the baby; you're working with either a midwife, an NP, or a doctor. There's actually doulas in hospital. One of the big challenges with a doula, they're not flexible because babies come whenever they want to come. So if you have to take an OCAM exam and the baby's coming, guess who's taking priority? And then there's also additional certifications like postpartum and advanced doulas. And again, I know in California, in like San Francisco, Sonoma County, Marin County, they use a lot of them, and it's a great experience to do that. Hospice care, again, you could volunteer. You're not providing direct patient care, but you're usually helping a family member or another person. You're sitting there talking to people, you make calls, you're interacting with doctors and other health workers. I know like some folks that do hospice care, they do it in homes. And so a lot of times they just need a volunteer to come in there and just watch the patient, talk to them, play cards with them while they go take a shower or do something around the house. And so again, hospice volunteers, a lot of big hospitals have them as well, and they love having volunteers. So take a look at that. Again, the sad side of it is that you're seeing people that are in end of life care. So you're dealing with death and again, if you want to be a doctor, that's what you have to, deal with. Um, Community health workers, there is programs now a lot across the state. I know City College has one, San Francisco, Sac City. I know a lot of schools are getting them because they got big grants from the state. So you should take 4 or 5 classes, and the classes are really easy. Some of them are like 1 unit. It pays really well. Most of the rural health clinic and FHQA, which is the federally health qualified low income clinics, basically, you're not providing clinic care, but you're providing support. So you make sure that patients are going to their mammograms, patients are going to their um, following up with their doctor's appointments, if they have labs that they need to come in. So it's a great place, and it's a really great place to get into clinics. And those jobs pay pretty well. I think in California you can make 18 to $20 an hour. And so find out where the training centers are. I know a lot of community colleges are starting to get them. And so check them out. This is another one that you could do again if you're interested in women's health, sexual assault crisis response. And the great need for it is basically when women, men, kids are usually done by professionals. It's a little bit more, but basically some of them are volunteered, most of them are paid. You get a pager or your cell phone, and then if somebody has been assaulted with a sexual assault, you go to the ER that you're assigned to in your county, and you're basically um, providing, you're not doing anything in terms of like, but you're basically there for the patient emotionally. You learn a lot of the skills and skills to provide and make sure they follow up. And you're with them the entire time. And some of those things take about 4 to 5 hours. And you just, you're not a counselor, but you're just providing support and you're with them the whole time. Usually, when somebody's doing the sexual assault, they have to do it, and there's like chain of custody. And so they're not able, that nurse practitioner or nurse is not able to provide the care that and so that's where your role falls into. In California, the training is 68 hours. Some smaller counties don't have them, and so, like, let's say if you're in a smaller county, you may have to go to your adjacent larger county to do it. Um, and so, yeah. And this is another one. I'm actually almost over. And then my colleague is gonna come in, and I'm gonna answer some of the questions as well. And somebody asked a question, working as an optometrist office or a technician count as clinical experience? I would say it depends. I think it's a yes and no answer. yes, you're dealing with patients and stuff, but I think if you want to go to medical school, I would highly recommend you to look at these other things that are out there. But also, you have experience as an optometry technician, and so you actually have a leg up versus somebody who doesn't have it. And so I would say, I'm pretty sure if you're working in an optometrist office, they will know doctors and they could connect you to doctors that they know. Some optometrists know ophthalmologists, which are the higher level that provide surgery care. And I'm pretty sure optometrists know a lot of ophthalmologists. And so you could say, hey, you've worked there for 6 months. Hey, I'm really interested in going to medical school. Can you know any ophthalmologists that I could shadow? They shadow an ophthalmologist. They do surgeries and procedures, some of them in office, some of them in hospital. And then you say, hey, do you know another person that does, I don't know, you're interested in ER or brain surgery, whatever. And so this is kind of one of the ways it's called parlaying. Um, and then the dental technician, somebody asked me about dental tech. I would say if you want to go to medical school, dental tech, even though you're providing direct patient care, I would say highly get into a hospital setting because you want to go to medical school. Somebody is interviewing you saying, okay, you have 2,000 hours of dental technician. Why aren't you going to dental school? So, it's great. Dental technicians make really good money and it's a good paying job. And I'm pretty sure dentists know a lot of doctors. So you could parlay that as well. But at least you get that clinical shadowing experience. This is another one. You could do it at your own home. It's crisis text line. You could become a crisis counselor. You spend 30 hours. You could stay in your home. You are in your PJs. They ask you for at least have a 200-hour commitment and a 30-hour training. And this is the process. And you could go to their website and you could do it today. You could even do your 30-hour training during your break. So this is something you could do. It's all volunteer. And if you are a thumb warrior, you know, um, it's a great way to provide that. And they train you and all that stuff. And you could, get experience. It's volunteer, so you don't get paid. But again, it's a great service. Food insecurity is a really big one. Food insecurity, food banks, they need volunteers, community gardens, World Central Kitchen. I've done some work with them. And so these are organizations that you could take a look at. This is an organization that is that's dear to my heart. I've been involved with them for a really long time. Each county has a chapter, and you're basically providing advocacy to a minor through a court system. You work with children that are going through the court system and you report to a judge. It's a really humbling experience, really needed. I actually got to know a federal judge through this process and offered to write me letters of recommendations for many things. You get very good at learning and listening and writing, and you're basically closer to some of these kids' ages, and you could be a friend to them, and they may feel a lot more comfortable with somebody that's closer to their age than somebody who's retired. Everybody that I know in CASA is in their 50s and 60s, really wise people, really smart people. Um, and I've met some pretty amazing people that volunteer with this thing. Um, and yeah, and so that's a kind of a special thing in my heart that I always make a plug for. Um, this is another one that you could do, Red Cross Disaster Action Team, with all the things with fires and floods and everything that's happening. You show up to a disaster, you give vouchers for food and hotel to people. You could even become nationally certified and you get to travel to disaster situations. You get to be a shelter manager. It's a really good experience. Locally, you don't get paid, but if you get activated nationally, they do pay you. They also pay for all your equipment. The equipment is basically like a jacket, clothes, and then travel anywhere that you go. And you're basically locally, you're providing service to people in your own community. So somebody's house burns down, the Red Cross Disaster Assistance goes out there and places people in hotels and other places. Um, usually 7 or 8 classes that you have to take to do that. And you can do it as a group. So you can have a Red Cross club, or if you're part of an organization, it gets, 10, 12 of you, and they'll actually do the whole training for you. And they really need young people to do this. Reason why is like they found with a lot of disasters that's been happening, you have a lot of older retired folks in their 60s and 70s that are walking on side of a burnt hill, and some of them have been injured this way. And so they want people to, to do that. And it's flexible where that you get a cell phone and that gets activated, then you respond to it. Again, school and everything else do that. This is kind of like, I would say, long term, I won't recommend this. Certified medical assistants, it takes about 2 years, and some private schools are charging like 15 grand for it. And so I would not do that. And you're doing mostly a lot of medical billing and coding. So again, medical assistants, there's a lot of non-certified medical assistants, and usually they're CNAs or EMTs. Surgical tech, again, it's a long program. It's minimum 1 year with prereqs, which gets to be about 2 years. And the private school charge $20,000 to $30,000, and it's just a little bit too long. And then that's a really big commitment, I think. The other part of it too is 2 week international trip. Um, they're really unethical, and actually WMC has a whole posting on international trip, because you're not a certified professional, and then you're going out there and providing care for people that are usually browner and poorer than you are. And so I think, and so there's a huge issue with it. And the other part of it, it costs a lot of money to go to these. And so again, 2 week international trips may sound fun, but I wouldn't do it. Um, and and so yeah. Uh, the other part of it too, citizenship classes. If you speak another language, um, do it. There's a lot of local organizations that do this. If you've taken a government class, it's really easy to teach. And and so it's a great experience. I've done it and I love it. Um, and I personally believe citizenship uh, is a duty. And so if I could help other people become citizens, then it's about voting power. And so that's another thing that's close to my heart, and for people to do. I'm going to let my colleague Madeline talk about her experience and what she does.
Yeah, I'm going to talk a little bit about my job, which I'm a Mohs surgery histology technician. So I'm going to try to share some slides. I saw Giselle's and was inspired by her. So these are pretty quick, but sorry, I have to go through system preferences. Doesn't seem like it's working. Sorry, one more second. Okay, well, it doesn't seem like my PowerPoint's able to be shared, but I'm going to talk a little bit about what I do. So I'm going to type it in the Q&A right. Or no, Juven, I'm not able to send it to everyone, but if you could.
Yes, email it to me and I could run it if you want.
Okay, perfect. Yeah, I'll share it with you.
Email it to me and I could run it.
Okay, I just sent it right now.
Okay.
It's only 3 pages, just a little bit about my job.
Sorry. Okay.
Perfect.
Hello. Go ahead.
Specialized dermatology due to remove skin cancers. So on the next page, I have a little diagram. Jubin, could you go to the next slide, please?
This one?
Yes, perfect. Okay. So in this, you can see what Mohs surgery is. Basically, there's skin cancer and the surgeon will remove the skin cancer itself and then send it to a laboratory where it's processed. So I process the skin cancers into readable slides. So then the dermatologist will look at them underneath the microscope to see if there's any more skin cancer remaining. And if there is, they go and take another layer of skin. So that's Mohs surgery, just in a nutshell. But I think this was something I had not known about when I was a pre-med. And I think if you're interested in dermatology or also in research, doing clinical research in medical school, then this is a really good position for that because it trains you to work with specialized laboratory equipment that medical schools use during research. So also the pay was competitive, I thought. The starting pay in California is 18 to 22 an hour. And it doesn't require any certification or classes. So you do all on the job training. I would say the schedule is pretty flexible. You do have to commit full days. You can't have like a half day that you commit. So if you have classes 5 days of the week, that might be a little bit difficult. But if you have Tuesdays and Thursdays free, then this is a position that could probably work for a lot of people. So Jubin, could you go to the next slide, please? And this is just kind of the basics of what I work with. So that machine on the end, that's called a cryostat. And this is what they use in medical. Oh,
sorry.
No, it's okay. Okay, so there's a cryostat. And this is basically, it's in the inside of that chamber, it's frozen. And it keeps everything really, really cold. And then there's a mechanism inside there to like slice the skin cancer into thickness. And then I collect those with a slide stainer, and that creates something that the physician's able to read. So I think this is being familiar with H&E staining is a really valuable way to get familiar with histology, which is going to be a big part of medical school, is being able to look at these H&E stained slides and be able to see if there's any cancer or if there's any different diseases present, if the tissue shows evidence of disease. So I included what this slide would look like afterwards in the middle here. You can see it's that pink and purple staining. And then also on the side where there's that brown staining, this is another specialized stain that I do called immunohistochemistry. So I think just this is a really good way to get involved and learn some different clinical research techniques. These are things that will be really important in having some laboratory experience. And when you're in medical school, if you want to get involved with research, you can say, well, I already know how to work a cryostat, and I already know how to perform H&E staining and IHC staining. So it's just a good way to get your foot in the door and to start getting familiar with those research techniques. And also it is a bit flexible, and I really have loved this. You get to form important like relationships with different physicians. And if you're interested in dermatology, then this is a really good way to be a competitive applicant for dermatology residencies. So yeah, that's just kind of a brief overview of being a histology technician.
What are some of the requirements to become one?
So I know it depends on the program. In California, you don't need to have any specialized program. A lot of my coworkers are going for their HLS certificates, which is if you want to just have a career as a histology technician, that's a possibility. And those pay up to, I mean, those are up to 6-figure paying jobs if you get your AHLS. But if you want to go into medicine, which a lot of my coworkers are also doing, we're using this as a way to get clinical experience. All you really need is an associate's degree and then some free time. So you do need to be able to commit at least one full day. Ideally more than that. I think most of my coworkers do 2 to 3 days per week, and then I'm working 5 days a week. But you don't need to have a bachelor's. You don't need to have any specialized certification. You just need to be willing to work and do on-the-job training.
Very cool. All right. I'm going to get to the last part of it, which is the shadowing part. And if you have any other questions, somebody asked this question. I'm a pre-med student and I'm an anthropology major. Do I have a disadvantage to apply for clinical experience opposite the bio major, or should I just? I would say absolutely not, because nobody really like to be in a clinical experience. You don't even need to have a college degree or an experience, and so I would basically, it's absolutely fine if you're a pre-med student. You're a pre-med student, anthropology major. A lot of people do anthropology. Also, the cool thing about anthropology is that there's medical anthropology as well, and so and there's a lot of courses that you can take as well. And so I would say you're not at a disadvantage at all. So yeah. Anyways, I'm gonna go back. So this is the shadowing portion of it, and so shadowing portion of it is, how do you do shadowing? And so also somebody asked about HIPAA training, and so I'm gonna put a link on it. And I think it's a pretty cool thing. You could do it for I believe $30, and I put the link on there. And so it's a nice thing to have if you want to go to a doctor's office. Somebody asked this question, and I looked it up, and I remember I looked it up before, and I didn't put it in my presentation. I'll put it in there, but it's like $30. It's a national HIPAA certification. They'll give you a piece of paper and a card, and so this way it makes it a lot easier for a lot of places that you go to. So shadowing, I would say find a local doctor or local practice. Don't look at these big academic hospitals, because again, they have students, medical students, medical students, residents, fellows. And so if you're at a community college or a local community, find this out. You Google them, find it. And I would say sending emails to them, unless they post their emails on their website, which most doctors don't have it. Any kind of email that you send, um, you know, they're not going to put, and that email is going to get lost in their general email, or somebody's going to email it and delete it. So what I would say is find their full name and correctly and their address, write a one-page letter, and then attach your resume one page, and then put it in an envelope, and make sure you type their name and their title on the envelope. You could seal it or not seal it. That's up to you. If you seal it, they think it's a lawsuit, and so so I wouldn't seal it. I would just leave it open, but make sure it's addressed to them. And you're mostly, you're going to go into their office and either talk to their clinic manager or supervisor. Just say, hey, I want to give this to this doctor, and just say, thank you very much. They might not ask you what it is. They may ask you, is this a lawsuit? And say, no, it's not a lawsuit. It's just, just explain, hey, I'm a pre-med student. And in the one-page letter, these are the really important thing you need to have is introduce yourself in the first paragraph. My name is Madeline. I'm a graduate. I go to UCLA or Santa Barbara City. I'm majoring in biology. I'm also involved with my community. I'm the pre-med group, and I'm involved in student leadership, yada, yada, yada. Then you say you're interested in becoming a doctor, and you don't have anyone in your family as a doctor. You don't know any doctors in your family or any place else. And I would love to opportunity to shadow you and be inspired and learn from you, and follow in your footsteps. Kind of be humble. Also, talk about some of your predicament. Like, I'm the first person in my family to go to college, or like I said, I don't have any doctors in my family, and don't know anybody who's a doctor, and I would really like to dedicate my life to this, but I would like to make an informed decision, and you could be there to help me and inspire me. And then the third paragraph talk about that this would be a really great opportunity for me to do this. I'm available, these days. Now, um, if you say I'm only available Sundays from 8 to 4 or 8 to 12, you have to be available Monday through Friday. And so, and you don't need to have big blocks of time, but I would say at least 3 hour blocks to really get a good experience. Don't say I'm only available on Wednesdays from 4 to 5 and that's it. Just say like, hey, I'm available on Tuesdays and Thursdays from, you know, 11 to 2 or 11 to 3, or Fridays or whatever, but make sure it's Monday through Friday. Um, and just say that I'll be professional and I would, guide all your thing. And if you have your HIPAA training, you could even attach that to it. So they know that they're not, again, we talked a little bit earlier about this. And then, after, when you show up and they accept you, these are really important things I'm actually going to talk about is make sure you put your full name on your resume, not your slang name, not, whatever. Make sure it's your full name. Make sure your email is professional. I will tell you this right now. I would get so many emails from people that I used to run a program, and even like I was interviewing somebody for a job and they had like really unprofessional emails, like things that I can't even say. And if you have a cute pet name or whatever, make sure that that's not on your professional resume or email. And then you put your first or last name. If your first and last name is John Smith, then find some other variation. Also, don't have an email that has 75 dots and arrows and everything else on there, or emojis. Just make sure it's like, as short as possible and as sweet as possible, gmail.com. And make sure your voicemail doesn't have, you know, Little Wayne's song or anything like that. I actually was supposed to interview someone for a job, and I called them to invite them for an interview, and on their voicemail had like very misogynistic and curse words. And I told my boss, and my boss is like, "Yeah, we're not going to invite them." So, again, that's up to you. And I know that everyone is an individual, and you want to come out that way. But if you're using your phone for a professional thing, to make sure it's like that. We had the NIH director, training director, who basically said the same exact thing, that we get some emails that are really inappropriate, and we don't even email those people to invite them for those opportunities. So again, it's up to you if you want to do this or not, but expect me to be professional. Your resume, if you've never written a resume, make sure you go to your career center on campus, or anybody that reads resumes and does them. um, I've looked at a lot of people's resumes that are just not resumes. So make sure you go to your college career center. You go look online. Online, there's a lot of templates and there's a lot of information on there. So make sure you get a resume that's professional and doesn't have any spelling errors or grammatical errors. Another thing about shadowing is, after a while, when you're up there, look and see how you could help if you speak another language, and if you have some sort of certification, or if they have any requirements to be a translator, you could do that. Also, social media. A lot of doctors now need to have a social media presence, but most of them don't know what social media is. So, after a while, they get to know you. I would say after maybe 50 hours, offer to help them. Hey, I have a I have a Instagram page or TikTok or whatever, and I got like 20,000 followers. And they would jump at the time that you could help them, and they may even pay you a little bit. So, and then thank them Um, and so this is kind of like after a while you've established yourself in your shadowing. And also in your letter, make sure you thank them and you have your contact information and sign your name in the letter. Is really professional when you sign a letter that you're signing to them. And so, and then also I would say the things that you could help with as well, you could put that in your third paragraph and say, hey, I I'm fluent in Spanish or Urdu or whatever language. I also can help you with social media, coding, anything else like that. And so again, this is another opportunity for you to do that. If you have any questions, please ask away, type in the Q&A. If you have any other questions, you could email us and I'll try to get to those emails as soon as I can. And so, yeah, so I know this went a little bit longer than it should have, um, but hopefully it was helpful. I put it in the chat. Also, if you go to our website, you could also send in the message through there as well. You're welcome. Somebody asked what kind of experience the medical interpreting count. I think it's more it's not direct patient care, so it's healthcare experience. Again, you're in a hospital and you get to see things and you get to interact with doctors. So I think that's like the biggest takeaway from that is you're getting experience and you're getting to meet doctors and healthcare team. Uh, some people want to find out more about becoming histology or Mo technician, histology tech. Do you have any other website that you could put into the chat?
Yeah, I mean, it's kind of hard to find information. You can definitely email me. I'll put that in the chat, just my email, madeline@premedcc.org. I'm looking up. I know that there's job listings on Indeed right now, specifically for my company, but there's other ones that are hiring. It's definitely an in-demand job right now. So
Somebody asked, does shadowing a doctor have to have an education? No, you don't need to be certified at all. Shadowing is just basically you're showing up there and you're following a doctor and you see what they're doing. So you don't have to have any kind of certificate. That was not, I would say it's nice to have your HIPAA training because a lot of places don't have it. And so if you could get that, and I put that link in the chat. So have your HIPAA training and have your BLS. I would say those are the two things you should get as a pre-med student. Have your BLS, it's like the most important one because any kind of job you want to do, CNA, doula, MOTech, histology tech, you have to be CPR, right? Madeline? You
I
don't? Oh.
don't think you have to. I am.
Um,
But I don't think it's necessary.
I would say, gosh, this is an international student. My only form of ID is my passport and F1 visa would be insurance when I would say it shouldn't be, because even if you get a student visa, if you have a student visa or F1, you have gone through Homeland Security, so I think you should be fine. But I'm not the best person to answer that. Should we have varieties of experience or stick solely to example scribing? I would say do the things that are important to you. Variety is good because, like, for example, I know myself, like, if I would go to a hospice care, even though I think it's really important, I would be bored to death. I work in an ER. I'm used to um, high paced, and so it would not be something for me, but experience it. I would say the biggest thing with anything that you do for your medical school application, spend 6 months doing it. Because that gives you enough time to know if you like it or not like it. So, but again, some of you may need, but I would say 6 months the minimum. Some of you may want to have a longer experience. Like for example, Madeline's been doing her thing for a year. I've been in ER tech for a few years. So
I
I would
think
say,
to add on to it, you know, also you want you want to show commitment, like you were saying, and then also, you know, maybe what you're doing doesn't give you everything. Like my job doesn't give me any direct patient contact. So then I find other, you know, through volunteering, that's how I got that aspect, you know, working with patients where I just work with doctors in my job. So you want to get a little bit of everything. You want to be working with doctors and also working with patients.
yeah, the CT, yeah, I don't know. I mean, like these opportunities all sound really excellent. Somebody just sent me the one for high school Stanford internship. Yeah, I mean, I think if this is something that interests you, absolutely do it. I don't know like every program that's out there, and I don't know anybody that's done that. So, yeah, if it's a program that interests you, absolutely do it. Like, you gotta want to do this to know that you're gonna enjoy it. Um, Madeline, somebody wanted to know about the daily activity or mainly in the lab as a histology tech.
Yeah, I am mostly in the lab. I will say that I don't work with patients one-on-one unless they get lost and they come wandering in looking for the bathroom, which happens pretty often. But for the most part, I am in the lab, but I also work with the doctors a lot. And I think that's the most valuable part of what I do is that I talk to doctors every day. They really depend on me to create something for them that they need to be able to do the surgery correctly. So I'm constantly talking with doctors. I'm in their office. I'm talking with the dermatologist all day long. So I don't get to work with patients that much, and I am in the lab a lot, but it's really valuable. And I've talked about it in my medical school interviews because I really do get to work with doctors more than I feel like I would have in different positions. I feel like this is one where you really get to form that connection with physicians. And they get mad at you when things don't go well. So there's a level of responsibility.
All right. Anybody else have any other questions? Somebody says, I'm getting an associate in biology, and my advisor says that there's branches when you go to, yes, absolutely. There is, when you transfer to a university, there's biology, general biology, molecular biology,
Evolution and ecology.
yeah, human biology. So yeah, and do whatever interests you, whatever. I mean, like for example, if evolution is really important to you, do evolutionary biology. You can still get into medical school and you can do whatever, like whatever you want to do. If you want to do um, ecology, molecular, anything. So yeah, and just figure out what those requirements are. Like everybody says, I want to do biochemistry, which is great, but you have to take like a full year of physical chemistry, which to me it's like, it's basically if you love inorganic chemistry and physics and calculus, then do it. But if not, uh, so you want to become, so you're not going to decide being an OBGYN until you're in medical school, until your third year of medical school. And I would tell you this right now, they're not going to really care about which biology you did when you're applying to OBGYN residency. It's what you've done in medical school and on your rotations, the letter that you've done, OBGYN is actually a required rotation in medical school. So that's going to have a much more, if you've done research in OBGYN in medical school,
If you are a
um,
doula.
if you're, yeah, I would say being a doula is probably a really good thing in your pre-med to do, because you get to deal with women that are about to have babies and pregnant women. And I would say that's going to be a lot more important than which biology you do.
I would
Uh,
say if you were to minor in maybe like women's health or women's study, that's something you could minor in, which might kind of help having that a different, like a humanistic approach on your application. They might like that, but you do want to major in a biological sciences.
yeah, I have a really good friend of mine who got involved with this organization called College Track. I think it's called College Track or Track College. It's one of them. I think it's College Track. Yeah. And he got involved towards his undergrad and then his post-bac and then his gap year. And that's pretty much all he did. And when he applied to medical school, like he was very competitive. He was working with a lot of disadvantaged students. Matter of fact, he was even telling me like when he went to his interview for residency, he was doing like a pediatric community, like it was one of those special tracks. And he's like, that's what he talked about. They weren't really asking him about, you know, what was your college major, but like he became a leader in that organization and he was running a bunch of stuff. So again, it's kind of like, you know, your major, I would say the most important thing about your major is major in something that you enjoy, that you like, that you could meet all your prereq requirements and you get the highest GPA. So, and residency, right now, it's worrying about residency is so far removed that I wouldn't even like, you know, it's so far removed. Now, if you know, like you absolutely know you want to do dermatology or neurosurgery or something, then get involved in some of those research and stuff. But yeah. Any other questions? Okay, well, I think we're going to end it since nobody has any